we are going to be doing a series on lithium. We're going to name it Lithium 101. This is what every nurse practitioner needs to know for boys. Imagine you are at a party. There's always that one person who keeps the vibe steady. No highs and no lows. Just balance. And that is lithium in psychiatry. But there's a catch. If that same person has one drink too many, things can go downhill quickly. Lithium is the same way. Our friend with a very narrow therapeutic level. They can be helpful or they can be harmful very quickly. And that's exactly why the AANP and the ANCC love to test us on lithium. Mechanism of action. Lithium does not fit neatly like the SSRIs or your antipsychotic. It works by modulating neurotransmitters like your serotonin, your dopamine, and your norepinephrine, and stabilizing mood. Lithium is the gold standard for mania and also for maintenance. Example, if patient is pregnant, remember that lithium increases the risk of Epstein-Barr anomaly. Therapeutic levels, maintenance 0.6 to 1.2. And that's your therapeutic level. You see how narrow that is? Toxicity, levels greater than 1.5 milliequivalent, can lead to some form of toxicity. And if they're greater than 2.0, toxicity level may be pretty severe. So always think neurotherapeutic index when we're dealing with lithium. So how do we monitor lithium? Monitoring. You always want baseline labs, especially for your renal function, your BUN and creatinine level. You also want to check thyroid, TSH. You want to have a baseline of your electrolytes. And you also want to keep monitoring lithium levels. You want to monitor all these labs while this individual is on lithium. And you also want to have a baseline before you start lithium therapy. So when that individual starts lithium therapy, steady state is usually reached between 5 to 7 days. So you want to draw levels 12 hours after that last dose. What are some common side effects of lithium? GI upset, diarrhea. You also have fine tremor, polyuria, polydipsia, and weight gain. Some serious side effects are going to be hypothyroidism, nephrogenic diabetes insipidus, renal impairments. For your exam purpose, if a patient is dehydrated or have hyponatremia, or they are on NSAID or an ACE inhibitor or some form of diuretics, this individual will risk lithium toxicity. It becomes really risky for these individuals. So the risk of lithium is going to skyrocket. Let's do a little scenario here. We have a 32-year-old woman with bipolar disorder, and they present with nausea, vomiting, diarrhea, and coarse tremors. She started hydrochlorothiazide last week for hypertension. Lithium level is 2.1. What's the most likely cause? The answer will be drug interaction leading to lithium toxicity. So the safest next step will be to stop lithium and hydrate that individual. So here, let's think about lithium as the brain's thermostat, but it only works in a narrow window. Too little and it fails to perform. Too much and it becomes toxic. For exams, always think, check the kidneys, check thyroid, watch the salt and water. Don't let your test prep get toxic. Stick with me for more psych med hacks that will keep your exam ready. So hit that subscribe button below and join the Advanced MP squad.